Occupational therapy. Well, in a simpler way, occupational therapy is a client centered health profession concerned with promoting health and well being through occupation. The history of occupational therapy. In 1914, a person named George Edward Barton was the first person to coin the term occupational therapy. He was an architect who became an advocate of occupational therapy after personal experience with treatment of illness. He later opened an arts and craft workshop in Clifton Springs, New York, which was called the Consolation House. Occupational therapy included Elena Klexlager, George Edward Barton, Dr. William Rush, Dunton Jr., Susan Cox Johnson, Thomas Bethel Kildner, and Isabel G. Newton. William Rush Dunton Jr. is known as the father of occupational therapy. He was a psychiatrist and an educator. Dr. Dunton published the first account of the occupational therapy. Elena Klexlager was known as the mother of occupational therapy. Occupational therapy emerged as a profession in 1917 in the United States of America, that's USA, when the National Society of Promotion of Occupational Therapy, which was known as American Occupational Therapy Association, in abbreviation AOTA, was established. It was officially named occupational therapy in the year 1920. In the 18th century, patients suffering from mental illness were considered a threat to the society. The majority of those affected were simply stuck in prison and hidden from society. As human rights causes and moral treatment came into the scene, the more human system for treating mental diagnosis developed. One of these developments was asylums that provided a safe space. During the 1900s, occupational therapy began to come into existence. At this point, occupational therapy was more holistic than ever, but there was lack of evidence-based practice, and treatments were not fully understood. The majority of treatment was provided to those with severe mental health issues by promoting engagement in meaningful ADL and IADL tasks. A nurse by the name of Susan Tracy wrote the book Studies in Invalid Occupation, which outlined the benefits of occupational participation in mental health treatment. Around the year of 1915, Elena Klexlager organized the first educational program for occupational therapists. World War I was a pivotal time for the development of occupational therapy. The US military recognized the benefit of reconstructing ADs, providing OT services to those dealing with mental health and physical dysfunction challenges. During this and the subsequent Second World War, a great push was made for occupational services to be provided to wounded soldiers. It was during this time that a drastic shift was made from simply utilizing arts and crafts to using activities of daily living in the treatment of variety conditions. This push and advancement greatly served to solidify the value of occupational therapy on the world scene. The philosophy of occupational therapy is a set of ideas and beliefs relating to the field of practice. It includes ontology, epistemology, and axiology. That is the philosophical framework of occupational therapy. Philosophy of occupational therapy facilitates health and promote growth, change, and adaptation. The ultimate goal of this focus in the achievement of health, well-being, and participation in life through engagement in occupation. The scope of occupational therapy includes the domain and process of occupational therapy services. The domain of occupational therapy is the everyday life activities that people find meaningful and purposeful. Roles of occupational therapy. Occupational therapists are responsible for a wide range of duties and tasks related to patient care, depending on the setting in which they work. The roles of occupational therapy often include evaluating patients' conditions and needs, developing treatment plans to address patients' needs and help them to meet specific goals, assessing a patient's home or work environment and recommending adaptations to fit the patient's needs and improve independence, training patients and their caregivers to use special equipment, assess and document progress for evaluation, billing, and report processes. The common occupational therapy practice areas include children and youth, productive aging, mental health, rehabilitation and disabilities, health and wellness, work and industry. Occupational therapists may work in hospitals, outpatient rehabilitation centers, skilled nursing facilities and nursing homes, schools, and in-home healthcare. Occupational therapy fit into the South African healthcare system since they provide many wide-ranging services to a variety of people from infants to older adults. Occupational therapist provides people who have been referred by a physician due to a problem with their ability to perform normal activities of daily living, which are the ADLs. The pillars of healthcare are nutrition, exercise, relaxation, and sleep. So the occupational therapy profession is in line with the pillars of healthcare since they offer relaxation and sleep of someone's mind and body. This will influence to the wellness of your body. And the occupational therapy etiquette is all about making the patients being comfortable when they are around you and making them to be free. They must feel free and have no hesitations to talk to you as a practitioner or someone who is helping them with their process to recover. This may include networking, eye contact, greeting before you can even ask something else. Change it into being a successful profession. We have HPCSA, which is the Health Profession Council of South Africa. It is a government regulatory body which includes information on registration and continuing professional for health professions. We have the international body in control of the occupational therapy is the one known as WFOT, which is the World Federation of Occupational Therapy. It is the beneficence, non-maleficence, autonomy, duty, veracity, fidelity, and procedural justice. Beneficence, the Health Professional Council of South Africa's Code of Conduct deals with ensuring that healthcare practitioners are fit to practice their professional free from any physical or mental impairment.